Good morning, everybody, and welcome to Eldercare's Thursday webinar series. And we are super excited to have you on today. And we are also equally excited to have Essence on here today. And this is going to be Mr. Rusty on the webinar. So I want to introduce everybody to Rusty. And guys, just keep in mind, this is a conversation. If you have questions, please put them in the chat box. We'd love to get those answers in real time. And, make sure that if you have anything at all you want to talk about, to let us know. So I will hand it over to you, Rusty, if you want to share your screen.
Absolutely. Let me get the screen share going here and start the slideshow. Hope everyone's doing okay. Sorry for any background noise. I'm in a coffee shop in North Little Rock, so I apologize. Got a lot going on. Obviously, it's a busy season. So as Melanie said, I'm Rusty Menke. I'm your market growth manager for Essence Healthcare here in Arkansas, and I also handle Southwest Missouri. We're going to talk. I'm going to give you just a kind of high overview of Essence Healthcare. We're going to talk a little bit about the 2026 plan. I can't share any 2027 information except for the fact that we do have some expansion counties, and I am at liberty to be able to share those with you. So I'm excited to let you know what those expansion counties are. As Melanie said, if you have any questions, feel free to come off mute, drop them in the chat, however you normally do that, and we can talk through those as we go. So some of these slides this is about a 45-minute presentation that I'm going to crunch down into about 25 minutes. So here's our leadership team. Glickness Ortiz is our vice president of Medicare sales. And then most of you have probably met or have heard from Jennifer Dixon. She's my boss. She's the director of Missouri Medicare sales and also over Arkansas and Kentucky. Brian Thornton handles Illinois. So we do have some plans up in the Chicagoland market. And then there's all our market growth managers. So Joe Cavallo, Essence, Raghi, Petra, and Jory are all on my team as market growth managers and serve those different areas. So what sets us apart? Essence was built on care, backed by experience, and focused on outcomes. And what do we mean by that when we say, well, we were founded in 2003 by a group of physicians who really wanted to enhance the healthcare outcomes for members. They had been practicing doctors and they saw that it was more of a let's put a Band-Aid on it and move forward versus let's really find out the root of the issue and try and address that. And so they founded Essence back in 2003. The first plan was in 2004. And we've mainly been focused in the St. Louis market. That's our biggest market, but we have since grown. We're in 5 states, and I'll share with you what those states are shortly. Our average member tenure is 6.2 years, and I want to point that out because that should be important to you. Once a member comes on board with Essence, they typically don't move. And that saves you a lot of time and trouble during AEP because you're not having to constantly find a different plan to put those members on. So your return on your investment grows because you're not constantly having to move that member around. I just want to point out that 94% of our calls that come into producer support are resolved on the first call. We do have our producer support and our member service team is all stateside, so you're not going to have that issue of language barriers that you may have seen in the past with some other carriers. So we are all stateside, which is really nice, and that really leads to our 4.5 star plan on our HMO. We're really focused on that, on the member experience. We're focused on the broker experience. Focused really highly on efficient prior authorizations and specialized care. And so we've been able to hold that 4.5 star rating for 6 years in a row. We're the highest rated HMO plan in every market we serve. And we have been named a best MA plan 6 years in a row with US News and World Report. So Essence is doing a lot of great things to really help your members and help you as the broker more efficiently take care of your members. So we always do a survey. Some of you may have gotten a survey with us from us over the past few years, but we just want broker feedback. And what we've seen in those surveys is, one, we get an A+ rating for high satisfaction with our broker support. We have the Flex card that is a huge benefit. That's for your dental, vision, hearing, and this year you're able to pay for some medical copays with your Flex card benefit. We've got a very competitive drug plan, strong member loyalty, and one thing that really stands out to me is our MOOP. We have one of the lowest MOOPs in my area in Arkansas and Southwest Missouri. So very competitive core benefits, but our maximum out of pocket. I know that's a big deal when you're sitting across the table talking to members. They want to know, hey, what's the maximum out of pocket I might have? And if life just throws me a curveball, and to be able to tell them it's 3350 is a great opportunity for you to put their mind at ease. So overall broker selling, the reasons brokers sell Essence. 49% of brokers told us it's our competitive benefits. Our brand reputation, like I said, in Arkansas, maybe not so much because relatively new market. This is our third year in Northwest Arkansas market. I think our fifth year in Central Arkansas. But our brand and reputation is really solid in the St. Louis market. And we have a lot of client requests that come to our brokers in that St. Louis market wanting Essence Healthcare. So, we're building our brand in Arkansas. We're building our footprint in Arkansas and Southwest Missouri. But like I said, we have been around since 2003. So well known up in that St. Louis market. And I always think it's important to find out who backs the carrier. And so we are backed by a company called Lumeris. I've been with them since 2011, partnered with them since 2011, since they came out. They're a value-based care technology company. And so what does that mean? Well, they're very focused on helping your member live a healthier, longer life, and however long that is. So they don't want to just simply, like I talked about earlier, they don't want to simply put a Band-Aid on it and send your member on down the road. We sign value-based contracts with our carriers. We give them that option because we want to reward the providers, because we want to reward those providers for doing the right thing for their members. So let's say you have a provider that deals strictly with cardiac patients. Well, how do we best keep them out of the hospital, and how do we best improve their overall health? Well, that's what that value-based care contract does, is it rewards that provider for doing what's best for that member and keeping them out of the hospital, out of the emergency room. So we really want to boost the quality of care for the members while decreasing the overall cost of care. And Lumeris is really big on that aspect. And they're huge on the technology side. So whether we like to admit it or not, AI is coming, and Lumeris is really focused on helping doctors improve their overall care with the patient by incorporating AI into their daily practices, taking some of the minutia out and off the caseload of the doctors to help them better serve their members. So I'm going to scroll on through. We do have a little over 61,000 members now across 5 states. So if you sell in St. Louis, Chicago, Mid-Missouri, Southwest Missouri, Northwest Arkansas, Little Rock, obviously, Louisville and Lexington, we are in those areas across those 5 states there. We have partnered this year and the last few years with Oura. And so all of your members are going to receive an Oura Ring, and their subscription will be paid for. We do have over-the-counter built into our Flex card. In our area, we don't have transportation, but if you sell up in that St. Louis or Louisville, Lexington market, they have Uber transportation up there, and I'm hoping that will come to us soon. But it's a great benefit for your members that are in that market. Our dental vendor is Liberty. We already talked about a little bit about the Flex card. I'll get more into that in a second. And our mail order pharmacy is Express Scripts. And your members can get a 90-day supply of their prescriptions for the cost of 2 months, which is a huge savings for your members. So there's our breadth of network. So it shows you some of our network partners that we work with. Silver Sneakers is our fitness partner. iMed is vision. Amplifone Hearing and is our hearing vendor. And obviously we do have that flex card, and it's provided by WEX. I'm going to skip over this a little bit. The Oura, 88% of our Oura members see their health improve. So it's a great benefit if you have members that enjoy that app and the ability to see how well they slept, how their heart rate is, all those good things. They are able to use that Oura Ring with its subscription. It's an app that they download onto their phone. And so I know not all of our members are going to be interested in that, but the ones that have embraced that Oura Ring have seen their overall health improve. So it really is a great benefit for your members. With our Flex card, they're going to have an amount loaded on there that they can use for dental, vision, hearing, and some of their medical copays. And then every quarter, their OTC benefit will be loaded on that same Flex card. So it makes it very simple for your members when they're out and about to be able to just pull out that one card and pay for those items versus having, one OTC card, one Flex card, one member ID card. So our preferred pharmacies this year are Sam's, Walmart, Albertsons, Safeway, and CVS. We are partnered with several mom and pop pharmacists, also Walgreens, the Medicine Shop, and Costco. But again, our mail order pharmacy is Express Scripts. So that's very simple. I'm excited about a new pharmacy we're partnering with next year. Unfortunately, I can't tell you that. You'll have to come to our rollout next week to find out who that pharmacy is, but it's pretty good. So I'm excited about that. How are we doing on time? Okay, looking good. So 2026 plans and benefits. Our 2026 counties that we currently have are in the dark blue. So in Northwest Arkansas, we're in Benton, Carroll, Washington, Madison, and then Central Arkansas, Conway, Perry, Pulaski, Lone Oak, Prairie, and Grant. But I'm excited to say that in 27, we are adding Crawford, Sebastian, Franklin, Johnson, Newton, Logan, and Scott counties in the River Valley. So that is really expanding our footprint.
Wow.
Yeah, that's really exciting. Obviously, Sebastian County, next to Little Rock, Fort Smith is one of the largest cities in the state. So that's going to add a big opportunity for a lot of new members coming on board. And then if you sell up in Southwest Missouri, we are adding Barton, Cedar, and Dade counties to Southwest Missouri. So I will say we are only expanding with our HMO in those expansion counties. So we'll still have HMO and PPO in our current counties, but our expansion counties will just have that HMO coming in 2027. And so let's talk just briefly about our plans. Obviously, both our HMO and our PPO are $0 premium. Our HMO, the MOOP, like I said, we've got a very low MOOP, $33.50. Our inpatient hospital stay is $275 a day for days 1 through 5, which is very low. $0 primary care, only $20 specialist. So let's say you have someone who's has a chronic condition that may not align with a chronic plan. With a $20 copay for a specialist, that's a great plan to put them on. Labs are $5. They do get $50 in 26. They get $50 per quarter on their OTC benefit. The Flex card has $925 loaded on for dental, vision, hearing, and that's in or out of network. And then they can use it for 26. They can use that Flex card for medical in-network copays. I will say preventive is built into our HMO, so they're not using their Flex card to pay for their 2 cleanings, exam, x-rays per year. That's already built into the plan itself. $200 allowance on vision, $1,000 every 2 years on hearing. got the great Oura Ring this year, and the silver sneakers is the fitness benefit for this year as well. And I do want to point out, our HMO, there's no referral needed on that HMO, which is very, that's a big selling point right there, that you have no referral that you have to get for our HMO.
That's great.
Go ahead. Did you have a question, Melanie? I'm sorry.
No, no questions yet. I just said that's great.
Okay.
That's
Awesome. Our PPO, again, $0 premium, $41.50 in network, $61.50 out of net, in and out of network combined on the MOOPs. $295 for days 1 through 7 in or out of network, $0 for primary care in network, 30 out, $30 in network or out of network for a specialist. Labs are going to be $0 copay if they go in network, 40% co-insurance out of network. There is no OTC on the PPO plan. We do have 1,000 that can go on the flex card for medical, dental, vision, hearing in or out of network, and it can be used for some of your medical copays. I will say, however, that the preventive dental is not built into the plan on the PPO. So they do have to use their flex card for their preventive dental, but that gives them the option of either using an in-network or out-of-network dentist on that. $300 allowance in or out for vision, 1,000 every 2 years for hearing, the Oura Ring, silver sneakers, and again, no referrals there. So I'll pause just a minute, see if there was any questions about our plan expansion or our current plans. Not seeing
Does
anything.
anybody have any questions? I'm not seeing any right now.
Okay. So let's talk about our current 26 plan, Part D side of our MAPDs. So it does have a deductible on tiers 3 through 5, and that's $340. Tier 1 is 0. Tier 2 is $3. Tier 3 is only a $45 copay on our HMO or a $47 copay on our PPO. A lot of my competition has a co-insurance percentage on that. So that's a really big selling point for your members there. $95 copay on the HMO on tier 4, 50% co-insurance on tier 4 on the PPO. And then we have a co-insurance of 29% on tier 5 on the HMO and PPO. Tier 6 is $0 copay, and there's only a tier 1 through 5 on the PPO. So there's no tier 6. That all falls under tier 2, that tier 6 would. I do want to point out that this year, anybody that is on an in-formulary insulin, that would fall under tier 6, and they would have 0 copay on that. So that I know the cap on that is 35. A lot of carriers charge that $35. Ours would be 0 on in-network insulin. And then those non-Part D drugs, tier 2, are covered. So some agent resources. If you haven't checked out essencehealthcare.com, I highly encourage you to. This is for agents, members, prospects, providers. It's a great tool that is out there. Lumeris, like I said, is a technology company. And so what they've, in my opinion, have done is they've really helped us bring everything into one area. So you're not having to chase from all over the place trying to find out where to go. So you can, if you're a producer, you can go there. You can look up our plans. You can find doctors. You can find our important plan documents. So let's say you're looking for an ANOC letter, or you're looking for the drug formulary, evidence of coverage. All of that is under the important plan documents on that website. Very simple to find, very easy to navigate. Your members will have a new member portal coming out September 1. It's going to be called everythingessence.com. And they're going to be able to learn about their benefits, change their primary care doctor, check their flex card balance. They can view, request, or print the new ID card, and a lot more. So it even will tell them where they're at in their maximum out of pocket for the year. And then our producer portal. Obviously, if you've been contracted with us, we just updated our producer portal. I know we've had some challenges there. I mean, just full transparency, it's been a little bit of a challenge for some folks because you have to download a multi-factor authenticator and all that. But it is much more robust than it was in the past. And the reason we added that multi-factor authenticator is simply because there's a lot of PHI stored on that, and we really needed to increase our security measures on our portal. So you can now on the portal go in, do your annual cert, you complete enrollments, track your applications, your book of business, your commission statements. You can download your whole book of business with all the contacts, your members' IDs, and all that good stuff is all there. And then also we have the broker beat there as well. So you can find out about upcoming trainings, whether those be virtual or in person, and sign up for those from that one portal. So it is a really great portal. I apologize to any of you who have had challenges trying to get that multi-factor authenticator working. Hopefully you've got that taken care of. Our producer support team has been a great asset. They've been really helpful to a lot of our brokers to get set up. So then I spoke briefly about our Broker Beat homepage. Again, that's where you can go to get all kinds of great updates. Highly encourage you to check that out on a regular basis. So how can you enroll people? Well, obviously our preferred method is electronic. We do allow a paper application. We do want that mailed in within 48 hours of the upload. And if you've gone through our certification, it has to be in within 10 days. So I had an agent text me the other day, hey, what's the answer to this question? I'm like, okay, now let's think through this. You just took the training. So again, our certification is very simple, but that is one of the questions on there. So now if you haven't taken the cert, you know the answer. And then we also do a telephonic enrollment that is agent initiated. So you're going to call in with your member in a three-way call, and our producer support team will complete a scripted telephonic application. You'll be the agent of record. They'll just take all the information on the phone. It's very simple and quick. And so if you're out of an area where you don't have electronic abilities or you don't want to take a paper application, that's the third option for you. And then here's our producer support and customer service information. So obviously I am available to help you. If you're having issues, just like with, most of I've been with a couple of other carriers, and all the carriers are the same. If you have an issue, we ask that you try and address that with producer support. If they can't help you, or if your member services can't help your member, then we can get involved and escalate that up. But there needs to be a ticket created, either producer support or customer service first, showing that we've given them the option and the opportunity to try and rectify the issue. So there's the information, there's the phone numbers and email addresses. I'll let you take a picture of that if you would like, so you can get that information out there to your members, and you can have it in your phone. Like I said, here's all the team, all the market growth managers information. So if you sell in St. Louis, there's Essence and Raggi Abadir. Raggi handles St. Louis and mid-Missouri, that Columbia, Jeff City area. Myself, Joe Cavallo's Louisville, Lexington, and then Jory and Petra are the Chicago markets. And one thing I didn't point out, it's not part of the slideshow, but one thing I do want to stress is anywhere we have a plan, we have reciprocity with those doctors for in-network. So if your member's in Little Rock and they want to go to Barnes Jewish in St. Louis to see a cancer doctor or a heart doctor or something, they would find an in-network doctor at Barnes Jewish because we're in network with Barnes, and they can go there as an in-network patient. And so if they go to Chicago, I've had a guy tell me that he had 2 knee replacements, and there's up in the Chicago market. Again, if the doctor's in network in Chicago with Essence, they're going to be in network for your members down here in Arkansas. So a great benefit, great reciprocity there with our plans.
Wonderful.
Here's our benefit landing page. If you want to take a picture of that on your phone, it'll take you to our landing site. And guys, that is it. It's again, I sped through a lot. I apologize, but any questions?
Yeah, I do see a question from Robert. Has there been any expansion in Indiana?
Great question, Robert. Unfortunately, not in Indiana. So we're just across the border from Louisville, Lexington there in a couple of counties, but that is it. So great
Gotcha.
question.
And do we have any idea of when they might be kind of sharing some 2027 sneak peek?
Well, my rollouts for my area are next week. So
Okay.
um I am
But they
fingers
have to be in
crossed that
person?
we're gonna have all of our rollout deck updated with all the benefits and I mean I can tell you kind of a broad strokes. Our HMO is very stable for next year. I think you're going to be very happy. Our PPO, we're taking some cuts on that. I think you're seeing that across the board with all carriers and PPOs. They're just not cost effective. It's very hard to control your medical loss ratios on the PPOs. And so we've taken some cuts on the PPO, but our HMO is I think you're going to be happy with our HMO, absolutely.
Okay. And one other question is like for rollouts and like I've got some agents in Illinois. Are they
Uh-huh.
also going to be doing that in person this coming up week or?
They are
Okay.
absolute, and well, it won't be this week, but let me share with you the.
Okay.
I'm going to stop sharing my screen here, but I can go and pull up rollout info. So if you'll go to this link right here, you can sign up for any rollouts, any of our rollouts, and all the dates and locations and everything are in there. Highly encourage you to go register
Okay.
for your local rollout. We will be hosting some virtual. We'll get those on the calendar shortly, but in-person rollouts, if you can make them, typically are better and more engaging, in my opinion.
Awesome. Does anybody have any more questions for Rusty today? I'm going to give you a minute to ask. Well, thank you so much for joining us
Thanks
today.
for having me. I appreciate it, guys. If you have any questions, feel free to reach out to me either via
Okay.
phone, text, or email. Happy to help out. So thanks for having me.
Yes. And
Talk to you.
agents, thank you for joining us. We're going to send you out an email after this. And if you are not appointed with Essence, you can click on get contracted now and we will get that over to you.
Thank you. See you
Thank
guys.
you. Have a good day.
You too.